Sweden has universal health care, so why are Swedes still buying private insurance? So I'm a doctor, frustrated with our system, just exploring systems around the world and sharing what I learned. So Sweden is one of the most misunderstood systems, so let's just break it down. So Sweden spends about 11% of their GDP on healthcare. The United States spends about 18 to 19%. Everyone in Sweden is covered. So healthcare is funded primarily through taxes, especially regional income taxes. So yes, coverage is guaranteed. You don't lose it if you lose your job. You don't get a $50,000 bill for appendicitis. And doctor visits usually cost a small copay, which in US dollars is like $15 to $30. But there is an annual out-of-pocket cap. So after you hit it, visits are essentially free for the rest of the year. Hospitals are mostly publicly ran. Primary care is tax funded. Specialists are generally within the public system as well. So what's the tension? Wait times. So Sweden has what they call a care guarantee. You're supposed to see a primary care within days and a specialist within 90 days. But in reality, some regions are really struggling to meet that target. So that's why about 10 to 20% of Swedes now carry private supplement insurance. Not because they fear bankruptcy, but just because they want faster access. So let's talk taxes, because this is where Americans immediately react. Sweden's total tax burden is around 42 to 44% of income. The US is about 25 to 27%. But here's the important nuance. That extra tax revenue doesn't just go to healthcare. It also funds paid parental leave, subsidized childcare, tuition-free university education, generous unemployment benefits, disability support, elder care, and extensive social safety nets. So when we compare tax burdens, we're comparing the entire social models, not just the health systems. Healthcare is just one piece of a broader welfare structure. So in the trade-offs, Sweden doesn't fear medical bankruptcy. And you don't tie health insurance to employment. You accept the higher taxes, and you sometimes accept longer waits for non-urgent specialty care. In the US, we spend more overall. We often get faster access to specialists if we can pay and have the right insurance. But coverage is tied to our jobs and cost anxiety is real. Neither system is perfect, but Swedes prove something important. You can de-link healthcare from employment entirely and still control national spending. So here's the real question. If you knew you would never face medical bankruptcy, but you might wait longer for non-emergent specialty care, would you take that deal? And if you want weekly breakdowns of how other countries actually structure their healthcare, I have a newsletter every week on Substack, and the link is in my bio.